Hello, class. How's it going? So, for our assignment, we're working with a pregnant population and trying to find out different exercises that might benefit them during their pregnancy that can still maintain their physical activity. Any kind of strength or aerobic training during that time is going to be very crucial to them maintaining their health. The three exercises I want to highlight particularly are going to be what I call a modified goblet squat, and I'll tell you why the modifications are in just a second. A barbell row, single arm row. I apologize, a dumbbell single arm row and a barbell straight from the floor chest push. Reason behind these exercises, we're looking for things that are going to keep our pregnant patient off of a prone position, so we don't want them lying on their stomach. Especially as pregnancy progresses, it's going to be a situation where they're not able to actually do it. But we're also trying to find something that's functionally beneficial to our patient. So it's a position they can get in and something that's going to be able to help them out during that pregnancy. I don't have the exact weight or equipment in the room. I do have something that's gonna that I do have lying around that it has a grip. So just bear with me. The first exercise I want to talk about is that single arm dumbbell row. So the idea behind this exercise, we'll have something to position ourselves. Whatever side, the ipsilateral side to where we're holding the weight, that leg is going to go back. We're bending forward and our hips are coming back and we're leaning down. So the idea is we're mimicking as parallel to the ground as we can by having our hips go back. Our contralateral arm can go onto something that supports us. And the idea here is we're pulling the weight up. So this is going to be our pull exercise. And working out not only the muscles in the arm to bring up the elbow flexion, but we're really working on our back muscles. Our back muscles here is really how you're going to know that the exercise is working. So common faults that you see here is people will put on the wrong leg and you have to change the motion as to when you're lifting the weight. Sometimes they'll rock their body up, so we're trying to make sure that we're keeping that position down. The only thing that we're doing is isolating the movement coming up and really make sure that the patient is able to feel it in their back. The muscles here that are coming up, I can do this exercise all day and just work on my biceps and anything that's going to cause my elbow to flex. But we're really focusing on getting that shoulder movement up and feeling that slight pinch in our back in order to maintain that perfect form. Next exercise from here is what I call that modified goblet squat. I'm going to change the camera angle just a bit. And the idea here is we want to be able to focus on helping our pregnant patient comfortably pick something up. There's going to be times they have to pick something up off the floor. So that's what we're aiming for here. Idea here is just like a squat. We want to go a little wider. So whatever our base is, whatever we're trying to pick up, we're going ever so slightly wider than that. We want our hips going back first. So a common fault that people do is they'll just bend their knees to go down, which gets you to the floor and it gets you to where you're needing to go, but it's putting a lot of strain on your knees, especially in a situation where a pregnant clientele is going to be gaining weight because of that pregnancy. It's going to put a lot of strain on their lower extremities, especially at the kneecap. So we really want to avoid that. In order to avoid that, our hips come back first. So we're a little wider than where we need to go. Hips are coming back. Back is staying straight. We're maintaining that. We don't want our knees going too far past our second toe. So that's a good way to cue your clientele and make sure that they're really focusing on going down with the hips as opposed to the knee. We're reaching to the sides. They're a little bit wider and coming right up. So the idea behind this is we're able to comfortably pick up a box, an item that might be on the ground, a piece of article of clothing. We're comfortably able to come down and avoid putting any unnecessary strain on our knees, unnecessary strain on our back, because we're doing so in that modified goblet squat. Now, a goblet squat is normally, I have my weight here in my hand, and we're mimicking that squat. The modification here is instead, we're picking it up off of the ground. Our third and final exercise, we're going to go all the way to the ground here. Is going to be a barbell push. And again, this is a situation where we're in a supine position. We are able to cue our clientele here, and we're able to get a push out. So it's kind of like any kind of chest press in the gym with heavier weights, here they can grab anything that's available. I'm holding a dowel rod here. A broom would be adequate, but what we're looking for is shoulders up, arms out to a 90-degree angle, so that 90-degree angle between the elbow. And when we're pushing here, we want core engaged, so that transverse abdominis. Think about pushing your belly button down to the ground or bringing your hips together. We have that bend. We don't want our common fault again. Supinator, allowing too much flexion or extension at the wrists. So we don't want the weight on our wrist already. We don't want it to go too far back, because if we are training for heavier weights, this will cause a lot of issues with the wrist down the road. We want it perpendicular to the ground. Have a nice grip. And then from here, we're working up our chest muscles to push this up. Straight up, right back down. And this is an exercise that, with a little bit more comfort with the form, we can wrap different kind of weights around our dowel rods. We can wrap jeans or attach something to the ends, as long as it's evenly balanced. But it'd be something that we wouldn't need to have expensive weight training equipment in order to fulfill that motion. And it's something that might improve the compliance and adherence with our patients and our clientele, because it's not something that they need to use a lot of money on. Those are 3 exercises I think would benefit a patient who was during their pregnancy a vast amount, and hopefully it's been beneficial to you guys. Have a great rest of your day. If you have any questions, don't hesitate to reach out.